So if you're hypermobile, especially if you have hypermobile Ehlers-Danlos Syndrome or Hypermobile Spectrum Disorder, and you've been living with chronic neck pain or unexplained symptoms like dizziness or headaches, you might be wondering if it's something more than just getting older or another strange symptom related to hEDS or HSD. One potentially common cause of these symptoms is upper cervical instability, or UCI. Research shows that mild UCI may affect up to 52 to 66% of people living with generalized joint hypermobility, while more severe cases are less common, occurring in about 5% of this group. Yet even mild UCI can change your life in a negative way if it's left untreated. UCI refers to excessive motion in the upper part of the neck, where the skull meets the spine. This instability can involve the atlanto-occipital, or C0 to C1, and or the atlanto-axial, C1 to C2 joints. For some, it causes mild discomfort, while for others, it leads to debilitating symptoms like neurological issues, dizziness, or even fainting spells. Recognizing it early and taking appropriate steps is crucial. Before we dive into action steps, let's briefly discuss red flags. These are warning signs that require immediate medical attention, such as persistent dizziness or vision changes, significant loss of coordination or balance, and I'm not just talking a little bit where you feel clumsy like you may at other times. I'm talking severe loss of balance or coordination. Severe headaches that worsen with activities like coughing or straining. Sometimes people even describe it as unrelenting. If you've experienced any of these, please consult a healthcare provider right away. What can you do? Now let's talk about what you can do to manage UCI safely and effectively. Here are some steps. First, we need to look at the research, particularly a 2023 research paper by Rusick et al., linked in the description below. You can read the entire study for free as it's open access, and I highly recommend doing so. The first step is understanding the irritability level in your neck. This determines the activities or exercises you can tolerate, so you can be certain that you have the right treatments prescribed. Have you ever gone to physical therapy with high hopes of getting better only to be injured? Having a physical therapist properly assess the irritability level in your neck, known as the cervical spine, may help your therapist make more informed decisions in the future and avoid setbacks. I also highly recommend giving them a copy of this study as well. So here's a general summary of how you can tell the irritability level of your neck. High irritability. You struggle to tolerate being upright, like seated or standing. You experience significant flares from small movements or light activities and need extended rest, often over 24 hours, to recover from symptom aggravation. Moderate irritability. You can manage daily activities with mild to moderate symptoms. Flare-ups occur but tend to settle more quickly, often within a few hours or overnight. And low irritability. You experience mild symptoms that don't significantly limit your daily activities. Flares are rare and resolve quickly, often within minutes or a few hours. Now, why is this classification important? Because for a therapist, in order to prescribe the correct exercises or interventions, or determine if they should refer out to another provider, we need to be able to classify how you fit into these categories. Because if we attempt to do strengthening or proprioception exercises with a high irritability neck right away, then we can lead to further aggravation, and that's not what we want to do at all. Whereas someone who has low irritability can often handle more types of hands-on activities, maybe some gentle massage in addition with strengthening exercises and proprioception exercises, as we're going to talk about now. One other note, for those with high irritability, neck bracing can be helpful. It may provide stability and reduce strain during daily activities. Just be mindful not to overuse it to avoid muscle deconditioning. And also make sure you talk to your physical therapist or provider to be certain that you have the right type of brace. Some people can get away with a soft collar, while others may need a hard collar, for instance, or another type of brace. And it's important to talk to your provider what might be the right one for you in your specific case. Step 2 is to focus on posture and breathing. Posture plays a huge role in managing UCI. We want to aim to keep your head and neck aligned by working with your therapist to strengthen your postural muscles and awareness of where your body is in space. Also, practicing slow diaphragmatic breathing can help relax the muscles around your neck and support the overall stability. This is because chronic pain can lead to an overuse of these muscles that are typically used in the fight or flight response, like when you see somebody breathe and they're like this. Sometimes this can be happening on a low level all the time because they're so stressed and we're using these muscles without even realizing it. Step 3 is to build a safe exercise program based on your needs and irritability level. Exercise is key, but it must be the right type. Pelvic and lumbar stability exercises are recommended as a starting place to create a strong foundation for your neck. Going right into neck strengthening exercises sometimes leads to disaster with UCI and hypermobility, especially with those of high irritability levels, because the body does not have a solid foundation that we talked about. Gradually add scapular and cervical motor control training like gentle chin tucks lying down or scapular squeezes as tolerated. These should be individual and prescribed by your therapist. A lot of times therapists will then progress into isometric exercises where you're simply contracting the muscles of your neck but not moving yet. And the most important thing here is that we continue to keep breathing. A lot of times when you have chronic pain or upper cervical instability, you'll begin to clench these muscles, especially if there's TMJ going along with this as well. So it's important that we continue that diaphragmatic breathing, breathing into the belly, into the abdomen, so we can direct the tension away from the neck. Eventually, your therapist should begin to include strengthening and proprioception exercises that take you through an actual range of motion like you're seeing on your screen now. I wanted to briefly share this example of how we strengthen patients with UCI who are also hypermobile in our clinic specifically. What you're seeing here is a device called the Next Level. It's a very gentle machine where you can see it's a platform on wheels. And what we begin to do with patients is we start with just gentle range of motion, lying down. Typically we'll have a mirror over the top of them so they can see that their head is turning appropriately and it's not side bending or compensating in a strange way that's only contributing to their pattern. So we're working on two things here. We're working on proprioception, which is the awareness of where your head and neck are in space. And we're beginning to connect your body to some of those small muscles around the neck. Over time, we begin to add resistance bands on the machine, like you can see now that I'm engaging on the machine. And then we begin to work on specific strengthening exercises of the neck using the Next Level. So if you or your therapist are having a hard time making progress with upper cervical instability and you've been cleared for exercise, then I highly encourage you to do a little more research into this Next Level device. It's just one of the many ways that you can go about this, but we've had great success with patients with UCI at our clinic as we started to incorporate this after doing the pelvic and lumbar stabilization first. Traditional strengthening exercises like those with pulling your head against a band are not recommended, as oftentimes you'll be overusing muscles that you don't want to use, and we never really get to strengthening the muscles that we need to. Adjunct treatments like gentle manual therapy, which may include things such as myofascial release or light massage or muscle energy, supervised by a skilled provider, can help. Biofeedback may also be beneficial. Remember, every person's path to healing is unique, so find what works for you and never give up, even if it seems like you're spinning your wheels at times. Lastly, if you're looking for support from others going through a similar journey as you, check out our private community at hypermobilitypt.com. We've created a free online space where people with hypermobile heads and HSD can connect, share tips, and find encouragement. Living with hypermobility isn't easy, but with the right tools and support, you can thrive. If you found this video helpful, please like, subscribe, and share it with someone who might benefit. We also believe if you liked this video and found value, you'll definitely want to check out some of the other videos on our channel, like the one on the corner of your screen now.